Hello, ladies and gentlemen, crypto deep divers. Welcome back to Weekly Crypto. So today I'm going to talk about the mix and match COVID-19 vaccine. And before we get into that, make sure you subscribe to my channel so you don't miss out the upcoming videos that could be time sensitive. Also, you can follow me on Twitter, Odysee. So Odysee, right now we have huge censorship in Facebook, YouTube, Google. Yeah, so that's why I don't use Google. I use DuckDuckGo because even though when you're searching stuff, they will limit the results that coming back. That is pretty scary. And also you can follow, you can join me in Patreon group. So yesterday I posted a video about how coronavirus vaccine works and the implication. So I differentiate different types of vaccine. For example, Pfizer and Moderna versus AstraZeneca from Oxford University. So let's talk about, is it okay to mix and match the COVID-19 vaccine? Right now in England, they are going to do a study on this. So AstraZeneca and in collaboration with University of Oxford, they have a vaccine already came out, right? And they're going to, because of the vaccine shortage and all that, they are planning to do a study that involved more than 800 volunteers across England, 50 years of age or older. And this is the first study to analyze a mix and match approach to COVID-19 vaccination. So the thing is, sometimes it's difficult. If the person get the first dose of Pfizer, they may not be able to get the Pfizer, or they may get a Moderna or Moderna Pfizer. And the study, basically, they're going to give first dose of Oxford AstraZeneca vaccine first, and then followed by the second dose, the mRNA Pfizer vaccine or Moderna, or they're going to give Pfizer first, then followed by a second dose of the Oxford AstraZeneca vaccine. So this is just mix and match of different the availability of the COVID vaccine available right now at this time. And so this will be given 2 doses 4 weeks apart, and some other participant will be given the vaccine 12 weeks apart. And so, and also they will draw blood samples, and the researcher will also test the impact of like mixing and matching on the immune response and see if there's any side effects, stuff like that. So it makes perfect sense as a public health standpoint, because sometimes it's difficult to get the same brand vaccine. So it makes perfect sense for public health standpoint to do this study. And the thing is, this is a different types of vaccine. AstraZeneca utilizing the DNA technology, and Moderna and Pfizer, they're utilizing the mRNA technology. They have a different approaches in terms of vaccination. So in the video in my Patreon, I talk about the differences between those 2 vaccine, AstraZeneca versus the Pfizer and Moderna. So if you're interested, you can join my Patreon group. And the thing is, they're using different 2 approach, and now they're doing a study. And this is pretty interesting how it goes in terms of side effects and things like that. And also could mix and match approach, will that works? And what's the risk versus benefits in terms of using a mix and match approach? And I will continue on the discussions of this mix and match approach vaccine in my Patreon, because some of the information I cannot even talk about in YouTube. I may potentially get banned. So if you're interested, you can join my Patreon group. We'll continue the discussions of the mix and match approach of the COVID-19 vaccine. This is pretty interesting topic, probably in the scientific community at this time right now. And also as a consumer or as a patient, probably is a good idea to have an educated or more informed decision before you do this approach. But the thing is, at the same right now, basically, this is just a study. Right now, they don't recommend that at all in the US. In the US, also the current guideline in the UK and in the US, they don't interchange different types of vaccine. They use the same one. But this is just a study. We'll see how it goes coming out from this study. So if you're interested, you can join my Patreon group. And remember, crypto deep divers, we the people take control of our money, our health as well. Stay wise, stay safe, stay healthy. And I'm not your healthcare providers. any information I talk about this virus or is just for informational and entertainment purposes, not a health advice. You should consult with your doctor, or any questions or concern, you should consult with your primary care physicians. So this is just for entertainment purposes, not a health advice. You should always consult with your doctor before making any health decisions. And peace out.